If you're a new mom or dad, it's important to learn infant CPR. The American Heart Association is teaming up with the Rocky Mountain Hospital for Children with the Saving Little Hearts program. Their goal is to provide infant CPR anytime kits to families in the national neonatal intensive care units. Dr. Jan Kana with Rocky Mountain Hospital for Children joins me now with more. It's always good to see you.
Thank you.
Explain more about Saving Little Hearts program.
Well, this program is sponsored by the American Heart Association, and it's really targeted to families of neonatal intensive care babies. As those children leave the hospital and go home, they're more susceptible to cardiac arrest and respiratory problems. So we want to teach their parents how to perform infant CPR just in the rare chance they might need it for their child or another child.
That's important, and you say it's very important for everyone in the family to learn it, and also especially infants coming from the NICU.
Exactly. The NICU babies are more fragile, they're more susceptible to infection. Most of them have breathing problems that have kept them in the hospital for a period of time. We do require parents to go through a CPR training class, but this program allows them to augment that training and to teach other members of the family, other caregivers at home.
So all parents are required to take the program if they have a baby in the NICU?
That's correct.
Gotcha. How long does it take to learn infant CPR?
You know, it's really fairly straightforward. People are kind of scared about it, but it only takes about 20 minutes.
Really? That's it?
That's it.
How exciting. Is it important when it comes to performing CPR? I mean, what are the important things? Because the babies are so fragile and so tiny, you don't want to like crush any bones when you're doing CPR.
That's right. Well, one of the most important things is to start right away. If you really think a baby is in need of resuscitation, to start it immediately and not wait. Have someone else call 911. And then when you're performing CPR, you'll see with the mannequin, it takes a little more effort than most people realize, but people are scared about breaking bones or hurting a baby.
Would you mind showing me, giving me a little demonstration?
I'd be happy to. So essentially, you're taking your two fingers and you're pressing down, and on the mannequin, you press down about an inch, inch and a half, and you will actually hear a click when you do infant CPR on the mannequin. Likewise, when you're doing the breathing, you're using your mouth to cover the nose and the mouth, and you'll actually see the chest rise.
Oh, yeah, you do. Amazing. And so I think it's really important to point out, with your mouth, you cover the nose and the baby's mouth.
That's correct.
Okay. And when you hear a click when you're pushing it, on the baby, can you expect it? Will you hear anything when you're actually pushing the chest of the baby?
You will hear that click. We probably can't hear it here on the television, but that tells you that you've gone deep enough. And I think the biggest concern that people have is that if they go deep enough, they're going to hurt the baby.
Yes.
So this helps reinforce exactly how to do the procedure.
Very nice. Okay, and just two fingers right in the middle of the chest.
Correct.
And you press down how many times?
You press down 30 times, then 2 breaths, and then repeat the cycle.
Okay, and I always hear when you're giving CPR that the song, Another One Bites the Dust, is that it? Or what's the song that you go to? It's a song, Staying Alive. Oh, Staying Alive. Okay, so it's staying, like go to a beat.
And it's a little different than pediatric or adult CPR. And so we think it's important that people learn infant CPR. The information that comes for parents actually has a DVD that goes through it. It has this mannequin so they can practice and reinforce their training at home.
Where can we get one of those infant CPR anytime packages?
Well, at Rocky Mountain Hospital for Children, NICU, whenever parents go through the CPR class, they will be able to receive this box and take it home with them for free.
And everyone knows, I mean, if you don't, I'll tell you now, Rocky Mountain Hospital for Children, amazing hospital, saved my son's life. So thank you so much for coming on the show, Doctor.
Thank you.
Yeah, great information. Over the next 2 years, the American Heart Association will give the infant CPR anytime kits to families of patients in the NICU at all Rocky Mountain Hospital for Children locations. The American Heart Association also encourages parents to use these kits to train additional caregivers, babysitters, grandparents, and friends in life-saving skill of CPR. Learn more online at heart.org/Denver.